Hey guys, Dr. Lisa here. So I was watching my man, Greg Todd, rocking out to his hip hop and his music. And I said, well, that's so opposite me. My way to zone in is this. And I thought that would be funny to kind of show the differences there. But Dr. Lisa here, Dr. Lisa Holland, PT, Integrative Physical Therapist, coming at you today from beautiful Charlotte. We've got beautiful Charlotte blue Carolina skies today, feeling the crispness finally of fall. And I wanted to talk a little bit about personal connection. I've been having this discussion a lot with clients on the professional side, and also with some groups, because what is my deal? My deal is that I am 44 years young, and I have been a yogi now for, I dabbled in it, got scared by it, mid-90s, wanted to bring it into physical therapy, and then I really got into it when I was pregnant with my first child in 99, and then I got more serious, more on the spiritual side a couple years after that, studied deeply and got my guru teacher, Sri Dharma Mitra from New York City, 2009. So I integrated yoga early in the world of rehab or physio yogis. I had it in my practice, really was bringing it in 2001-ish, 2000. No, it was before 9/11 because I was up in New York, was working with MS and a group of children, just to jazz it up a little bit, gets a little boring with those little kids. And then when I opened up Belly Guru in 2005 in Charlotte, that was my main gig. So I brought that in because of this very topic of needing to see a biopsychosocial or a mind-body approach to healthcare. Because as an athletic trainer, which is what my undergrad is in, that was a given. You work through the psyche of the athlete to help them deal with their injury recovery. And then I was flabbergasted, big word, that's how I felt. I was flabbergasted at the total lack of the person in healthcare when I became a physical therapist and I went into the hospitals. So I knew I went on a journey for my own postpartum depression and dealing with pain and just jazzing my work up in orthopedics and sports medicine. I had found great benefit, and so it naturally became the gig with working on a niche practice and what I would call, I went into small business, but I'm now a micro practice within other things, working virtually as well as in person in a hybrid. But it's all been the same story, personal connection. And how are you doing that? Because I'm just not seeing it. I'm seeing the loss of humanity. I went into yoga to bring a little bit of that back out in my own personal practice. And believe me, I ran completely from the system in 2011. Totally broke the cord. Up until that, I was working a little bit in the hospital still. And I couldn't do it anymore. I sat in my last staff meeting. I think it was August of 2011. I sat in my last staff meeting. It might have been July because I gave a month. And said it was, a whole bunch of how I was going to get the hospital more money on their outcome measures, rate them a 5 out of 5. I was behind in my notes. Because I was trying to give quality care during the day, and we were transitioning to a system for Medicare online, and it was just behind, way behind, and I had to sit through that 45 minutes on, and then, how nice people write a card and say, oh, so-and-so was such a great therapist, thank you so much, but you don't get extra money for it. And learning how to subliminally inject the word excellent care into my clients' minds over 6 weeks, so that at the end, when I gave them the beautiful card, I would get an excellent care for the hospital and for the department, and possibly my supervisor's raise, but it would not get to me. Of course, because I was part-time, right? Trying to work that work-life integration with my household and my family. And I just said, enough. And so now, the yoga is very, very helpful because I'm always working that way. I'm always working with the individual, call it energy, or, it's just dealing with the person. And now it's becoming more mainstream, so, I'm not cuckoo anymore. I'm not that cuckoo therapist anymore. They're starting to see the value, and they're starting to see the science. Science caught up for me. But what was that all about? It's about having a connection, and I would absolutely love if whoever's watching this could tell me how they keep the connection, either as a clinician with their clients, or a coach, health coach, or a yoga therapist with their clients. Or I would even more so love to hear why you, the public, who might be a former client of mine, might have felt the difference, or even you have no idea, we haven't met, you follow my stuff here, why you might have had a really remarkable or wonderful experience and what that really was about. Because I think if you don't say it, then the hospital systems and the conglomerates in healthcare are going to keep stepping on the little guy or the micro practice to say that they're not having a remarkable experience. The insurance companies are going to sure as heck keep qualifying what to give you in your insurance benefits and what to pay the payers, what the payers are going to pay the clinicians based upon them saying, oh, you got, a 5 out of 5, excellent, because I subliminally clicked it into your head for 6 weeks, how you were having some excellent care, whether or not you were getting better. Overall, you would think, yeah, I'm not going to write excellent if didn't get better. But you might be leaving with not 100%, because I didn't make that connection. I didn't really give you what it was you actually really needed, but you're like, hey, it's good enough. For some reason, I feel like I should say this was excellent care. She was a really nice gal. She smiled all the time. So how are you getting that? What makes the difference? What makes the difference when somebody cares for you, that you would say really that it's excellent care? What's that connection? Because I'm going to tell you right now, for me, it means that you sit on my nice little couch here in this calm blue room, listening to my yoga music, and we talk, and we decide where the focus is for the day, and then we decide how that's meeting your goals that you set. That you set, by the way. Did you hear me say that? You set it. I didn't set your goals. And then we work through that, and we connect. And each and every time people leave here, they say they feel better than they came. I am no longer associated with physical terrorism as a physical terrorist, aka physical therapist. Although I'm not going to say we sit here and om and don't move. I think if you speak to any of my clients, and maybe if former clients of mine are watching this, you can attest to it in the bottom, you work. In fact, you work more than you probably have ever worked, because I'm a good body reader. I'm a good people reader. I'm going to get you right where you need to be gotten. And that's my skill, and that's what you're paying for. You're not paying for my 8 minutes quota of manual therapy. In fact, all of that comes with just me being me. It's a different package. You're paying for all of my years of study, my self-inquiry, my ability to blend all my stuff together and relate to you and help you figure yourself out, and then be able to relay to me what exactly it is you're here for. Because you came in with a pain, but then you told me you didn't at all want to change. And I'm not that girl. I'm not that girl for you. I'm gonna, though I do work as a primary care provider, but I may be the one that connects all the dots for you, and then we really realize you need to be in my next door neighbor that I share my space with, Belinda's, for some counseling, and it's beyond coaching. Or I may be the person that says, you know what, you financially can't commit right now. You don't see the value in what it is that I can give you. That, by the way, no one else has been giving you yet, and you already feel better. But if that's where you're at, that's fine. So we're going to spend 1 or 2 hours together, and you're going to come into my yoga class, because I already evaluated you. You paid for that. You were invested. But that's all you're willing to invest in your care right now. Or I might send you over to the acupuncturist, because that's something that you really liked in the past. And they're going to do the physical pain work, and we're going to do the health coaching or life coaching that complements, because really the stress is really what keeps getting you in this repetitive pattern of pain. So these are the conversations that I'd love to hear. Are you getting them? Are you not getting them? Would you like them? Why aren't you getting them? What do you feel is your barrier? And what are you personally bringing to the table to have those conversations, both as a provider or a person in the public? Because I'm on a mission to improve population health. I'm on a mission to improve healthcare across the board. I'm not just looking to make better physical therapists. I'm looking to create the brand new version of Health Leader. And that brand new version is probably going to overlap with a lot of different specialty professions right now. I don't mean in the skill set. We're all going to have our kind of way of going in. You know, the cardiologist is still going to be the best person to go to when you're in an acute state of dysfunction in your heart or cardiovascular system. But a majority of people are past that. We have an allopathic system, mainstream medicine, that stabilizes you. And then you're really up the creek, because we don't have a system right now that can do anything with you at that point that is validated by the insurance companies or pharmaceuticals or, you know, being taught in the medical schools or even, you know, down at the PT schools. We are all being taught to manage, Band-Aid, prescribe to the diagnosis, to the objectives that we see in our SOAP note. And the person gets negated. So how can we change that, right? Well, we need a different health provider. We need the health provider that has the cojones to step up and step out and know when it's wrong and create I don't know if we can fix this system. We need a parallel system that intertwines and then functions on its own, much like a child, right? Comes through me, is not me. Healthy parenting, they're not me. They're not my opportunity to relive my youth. Nor, if I dominate over them, will I produce an independent individual that can function without me. That's what we need. Calling out all you health leaders that are willing to birth the next generation. Maybe be part of it, be the foundation of it, definitely. And all you out there in public land to start commenting what it is you need. Because I'm listening. And I have the ears of a lot of people in the realm of wanting to do this for you. All right, guys, getting to the 15-minute mark. Hopefully I didn't lose you. Serious conversation here. Hope you comment. Hope you let your voice be seen, because you just can't complain. You cannot complain. It's like voting, okay? You can't complain about the next president if you don't go out and vote. So if you didn't at least try, even if you're like, the system doesn't work, I'm not going to be able, right? You can't feel better unless you try to feel better in this system. All right, guys, talk to you later. Take care.